hierarchy was the biggest thing that he talked about, because in the practice of medicine, there needs to be a hierarchy for certain tasks to get done. But to actually unpack how people feel about their work and diagnose and self-reflect how that work is getting done, you need to flatten that, at least temporarily.
Welcome to the 4th episode of the MD Edge Post Call podcast. I'm your host, Nick Andrews. In this 7th episode, we return to part 2 of our conversation with Craig Getting of the Lantern Theater Company in Philadelphia and Luis Montalva, a medical student with Thomas Jefferson University in Philadelphia. In part 1, we discussed why theater and medicine are more similar than one would think. In part 2, we really dive into how physicians and clinicians can get something out of art and out of theater. Here now from the basement of the Lantern Theater Company in Center City, Philadelphia, Craig Getting and Luis Montalva.
The way I talk about it when we're in the class is just to say, hey, this is a safe space to fail, so that you can just learn what that feels like, because that's gonna happen. And we've had folks write plays about very powerful moments of mistakes that they've made as professionals. You know, in the first 2 years, we had a couple of professionals or practicing docs and teachers in the course. And some of what they wrote were about cases that still bugged them. And thinking through, you know, one was actually about kind of the sequence of like, okay, I don't want to tell anyone because that might, I misdiagnosed a patient. I don't want to tell anyone because I don't want to be perceived as weak or failing. Okay, but now I'm still thinking about it, so I am not treating this patient effectively. And then that gets pointed out to me, so then my next patient, I freak out and look for everything and freak them out. And this cascading effect of not being able to metabolize failure. And not to say that like everyone's going to mess up big, but just it's a thing that, we were talking earlier, the competitive aspect of theater, like most people go to 10 times as many auditions as they ever get cast in. So actors just kind of cultivate, and I know a lot of them question it. They're like, why am I doing this to myself?
The doctors question it too.
Well, but then we get in the rehearsal room, and most of what we're trying to do is make a bunch of stuff that doesn't work so that we can find the thing that does.
Right. Yeah, like I find it really interesting the parallels we're seeing between the two worlds, but then also the overlap and how it can impact what's going to happen to you. So full disclosure, you are by far the youngest person that we've had on the show so far, and the only student, and so it's a completely different perspective than we've heard. I want to know, now that you've kind of done this, and right now it's fun and it's kitschy, and you're in med school, and there's a lot of pressure, you're on top of the world, you live in a big city, it's fun. But in 20 years, you're going to, hopefully not, it won't be as bad then, but be experiencing the things that we're addressing in this show. At that point, do you think you'll like whip out the laptop and maybe like, this is really dumb, but I'm going to write a couple pages of a play, or I'm going to call my person down the road and say like, hey, can I come and just like help out with the rehearsal?
Well, so I guess for me personally, I guess like Craig said, I self-selected into this program because I like it. I'm already like drawn to it. And I do a lot of writing myself, and I tried to, I knew very well, I guess, going into medical school that I guess I needed just the structure just to learn the material that I need to learn. And back when we said in the beginning that, my point of view is, I already feel like a doctor in terms of like there's a lot more than just like the technicalities of it. You need to know how to like talk to people. You need to know how to work with the situation and sort of like craft a treatment of management in a way that like helps, or like it's coincides with the personal preference of a patient or whoever you're working with. So I took some time off, and I actually thought hard about like going to medical school and why I wanted to do it. By the time I decided to join, I was already ready. I knew that, okay, I've done enough. I volunteer enough, but I also worked on a lot of things about myself, and sort of like figuring out how my reactions were, or figuring out where my biases lie, and got to get to know myself enough that I'm comfortable now. Now I know that I need the knowledge. I can't just be a doctor just because I feel it. Now I also need to know the actual medicine. So that's how I came into applying to medical school, and then finding this program was also a way to continue that going for me. And after it, actually, it gives me a lot of perspective, because even though I already came in with that, with this mindset, just being in that environment itself, you subconsciously just fall back into that like tunnel vision of like, I gotta get this done, I gotta get this done, I gotta get this done. There's deadlines, there's specific things that I need to apply to. There's, so having this kind of programs intermittently in between like my period here and the semesters, it's a way to remind myself. And you always kind of like fall off the horse, right?
Yeah.
So, but it's always like sometimes the more you fall off, the easier it is to get back into it. And I think as the years go through, it's definitely one. I'm able to see clinical aspects differently. I'm able to even go in when I see practice invitations. Now what I'm observing is not like, oh, can I do this? I know I can do this. I know I'll be able to do it. It's just sort of like, what are the challenges that you're facing and how are you dealing with them? And seeing where, for me, what do I need to start prepping myself now? Like, how can I prep myself so I don't lose what I have in terms of like being comfortable with mistakes? And like, because again, it was a self-selected group, but like as you saw across, like through when we started like getting more involved and getting closer and get like feeling like a more safer space, people started actually like laughing about like making mistakes. People like had a lot of fun. So it's not like they don't know it. It's just more, I think, like at some point, if you go long enough without transitioning out of that mindset of like life or death, then you start forgetting what it felt like. And that's how this program, I think, for me has helped me. And I do think I'll pursue something creatively. Whether it is performing with the guitar. At some point after this class, I did drumming, and I'm really into beats. And I actually, prior to coming, I was semi-professionally a dancer. So it's the art is already part of me, but I think that's again self-selection. And I think this kind of experience is definitely for people who are not necessarily involved or like already like have that kind of inclination, can serve as an experience to fall back into, like I like that feeling. I like that feeling of being able to have like a community, or being able to just fool around and feel like things didn't have like a big of a consequence, but it felt good. So for this program, I think the biggest takeaway is just how you ended up feeling, and that like is definitely going to last more so than the specifics how you go about it or whatever. It's more like, oh my God, that felt good. And at that moment, like, once you have the time to like slow down and think, oh man, what have I accomplished for my life? Especially like residency and whatnot, like everything at that moment, like
you become a resume.
Yeah,
like a living resume.
Right, you become a resume, and you just have to keep going because the pace is that way. The thing is designed that way, for better or worse. And I think you at some point you do need it, because you need the practice. You need to have like this hours, and you need to put the hours in to learn from experience. The best way to do it, it's just oh my God, I made a mistake this way. But hopefully during that period, you have someone watching over you, right? And
sure. Well, you say it's the same thing in medicine as with theater, right? Rehearsal is just just get it all out now.
Yep.
And then as you get closer to the opening night, you're like, okay, like it's more serious this time.
Yeah.
Let's make less mistakes, please. I imagine that it freaks you. It can freak you out a little bit less. Yeah. So one of the really cliche terms in acting, but it's not a cliche at all, it's a big cornerstone, is choices. You're going to make choices. Well, you said you write a script or a play, and like, what choices do you make? I think that a big part of performance is probably trusting yourself to make the correct choice for the thing you're looking at, and what the director wants, and what that your co-actors want to do. And I would imagine that in treating a patient or a specific case, or working with, if let's just say theoretically you were an interventional cardiologist, how are you going to work with your radiologist? How are you going to work with IM? How are you going to work with billing and nursing and the family? I'm assuming that learning how to make choices collaboratively without being told exactly what to do is going to pay huge dividends. But I'm just guessing. I'm kind of I'm not in either of your shoes, so I don't know.
Well, you've probably done your research very well, because that was right on.
I watch a lot of YouTube videos that break down scripts. Yeah, they're really nice. They're like really extended trailers. It's great.
There's a Stella Adler quote. In your choice is your talent. That was really it's really about making the right choices for a character, being present to make active choices while you're on stage, and not just planning it all out ahead of time. And also, I think increasingly we're seeing in the arts just kind of like where you choose to spend your time, what projects you choose to embark on. that is really indicative of who you are as an artist, more so than not necessarily more so, but just as much as your craft. So yeah, that's working on these plays, and when you talked about like the script writing process, Dean Spandorfer from Jefferson, after the first year, he talked a lot about the playwriting revision process as a clinic in diagnosis, and looking at the choices you had made as an artist and then holding it up for examination by the group to say, did it do what you thought it was going to do? Okay, yes or no? Okay, if it didn't, what would you do instead? Or given this audience, how might you accomplish that? And you're talking through those choices as a playwright, but you're also shifting in and out of a dialogue about the choices that characters are making.
Yeah.
You know,
Sure.
and one of the biggest things that an audience one of the most common negative reactions to TV, film, or whatever is usually someone being like, I don't understand why that character did that.
Yeah. Yeah, no, that's a really good point. We're like, that's out of left field, huh?
Yeah. But depending on how you set the audience up, you can, if you make the right choices as a playwright, you can prepare them for the surprise.
What is it called? The inevitable surprise?
Yes.
Where you're like, yes, it makes sense in the world. Like, I didn't see this coming, but it doesn't make me think that I'm in a play.
Right.
Yeah, well, that's the inevitable surprise that happens a lot in mystery, like a lot of Sherlock Holmes and Agatha Christie and stuff like that, or anything that's building to a reveal, where in the moment you don't want to see it coming, but it has to, when it drops, you have to instantly go, oh, of course.
Yeah, I know. Like, it's just like an instant. It's almost as if realization happens to you.
Yes.
If you didn't realize something, it's all engulfing.
Yes.
Yeah, man, that's really fascinating. So what have you learned from the choices that scientific people are making? Yeah, I'm sure, because I imagine that there's a big difference in teaching people who think this way, and it almost brings you back to the basics of directing, I would imagine.
Yeah, I've learned a lot in terms of perspective and personal narrative, and the power of personal narrative, but also the limits of personal narrative. So, and I think that's served me well when I worked on a couple new plays, because when you write a play, that when any character is close to a stand-in for you, and not necessarily saying that you're doing it on purpose,
Yeah, sure.
but a lot of the artists that that we deal with at Jeff, the students at Jeff, you're usually starting from something autobiographical, because a lot of folks aren't necessarily, if they haven't done it before, they're not comfortable just like coming up with a play out of whole cloth. So they'll take a person or a story that they know pretty well. So there's an analog for them. What ends up happening is you get this really powerful, honest exploration of an idea, but you might get some kind of cardboard stock characters who are the other people in the story if the playwright is basically in the story, they haven't taken the time to flesh those people out.
Right. So it's almost like a diary.
Yeah, and also like I have the luxury, we're working at Jeff, everyone's really, really smart. So like the plays are really interesting and the dialogue's usually really fascinating. But if it's a personal story and they have an antagonist of some kind in the play, or they have someone that they are kind of working through a relationship in the play, that other person, whoever it is usually a little underwritten in the first draft, because they just have to get themselves on the page first. So getting them to take a thing that is themselves and then turn it around and be the other person, learning how hard that can be for someone is something that I've certainly learned. And also like kind of learning the ways to anticipate that and coach that as a teacher. I've certainly learned a lot about being a teacher and working with not folks who would not traditionally consider themselves
theater
artists.
Track,
Yeah.
That makes total sense. So it's really interesting, because really fortunate, all of us here, if you're interested in art, to live in Philadelphia. I consider it, as someone who's interested in local film and theater, to be, and I hear this is a dumb word that people say a lot, but it's so true, is underrated.
Yeah.
In Philly, there's a real scene, and if one wants to try to break in to film or theater or any sort of palpable forever art, there's a real opportunity to do that. But a lot of our listeners are rural, and there might not be those opportunities. So I want to know, do you have any sort of guidance of where you would start if you even wanted to read a book or get online and sort of flesh out an idea? Because writing a play is intimidating. There's software involved, and it's sort of something that you don't really know how to do if you've not been trained.
That's fascinating. Can I just think about that? Yeah. So we have YouTube as a resource. Let me start there. There's a playwright named Lauren Gunderson, who's one of the most produced playwrights in the country right now. She's given a couple lectures through a theater commons called HowlRound on playwriting and storytelling. So folks are even like baseline interested in why stories are interesting and why plays might be interesting. Go watch those and see if you're inspired to do more. One of the things I've taken from that and will be bringing up in a lot of classes is that one of the most arbitrary things about stories is that they end. It's one of the most false things about them. But that can be a really good thing, right? Because then we can metabolize that information. If you're looking to kind of get started, I can't recommend just going and finding a community center that has a class and showing up for one and then leaving if you don't like it, but please get up there and, do some public speaking. But if you're interested in doing like playwriting, there's really nothing stopping you unless what you're really looking for is kind of a supportive environment in which to do it. And that's totally valid.
I imagine there must be like
online
forums
clubs,
and ways to to like have an online community, especially like if you don't have access to like a physical location.
Yeah, I might check out American Theater Magazine. Usually has a registry of theaters by state throughout the region, so you might be able to find whatever the regional theater is near you, and then from there on you can kind of go down because one of the great things about just in the Midwest, there's like a whole bunch of them. There's just regional theaters all over the place, and they're usually like pretty well funded for their region because they are the only game in town.
Right.
And a lot of the work that folks of us, those of us in the nonprofit space, we are trying to be not only just making good art for our community, but present in our communities.
I live one block north of the Arden Theater.
Yeah.
And we were season ticket holders just on principle, and then we started going to the plays, and then we started going to the events that they hosted, and now we give a little, like not a lot of money, but we give a little money. Like I enjoy participating, and I've seen 2 or 3 of the actors in multiple things. Like, okay, let's see how what's she going to do this time. And I think that just as a person, just as a dude, I get a lot out of that. And I think that there's you can drive past community theaters in northern Texas and think this is just it's a community theater, but
going.
Exactly. It's sort of like joining a country club. It's a lot of fun, but you got to buy into the
you
thing.
Have to buy in.
You got to buy in, and it's psychological, and you got to spend a little time. But I've noticed whenever I'm doing something artistic that it's 2 hours later out of nowhere. And you just want to do a little more. Maybe you want to practice. Maybe you want to watch, keep participating. But I think this episode's coming at a great time. We just had the opportunity a couple episodes earlier to talk with Samuel Shem, formerly known as Dr. Bergman. Yes, Samuel Shem. Are you familiar? You're going to be, because very soon all of your colleagues are going to start shoving a book in your face called The House of God. The House of God is considered by Newsweek magazine the second best satire ever. It's about medical residency. So and it's selling more now than it did in the 70s when it was produced. And we just got done talking with him, and he's he got through his medical experience through writing plays, and then it turned into novels.
Yeah, so that book was shoved into our hands when we started this program.
That's how you learn what doctoring is, right? This is the manual to doctoring.
Yeah, and it just kind of prepped me for the stereotypes both of doctors and patients that come out of intense work like that. In the same way that there are stereotypes of different artists and folks in theater that you're going to find just because people naturally slot themselves into roles to get by. And so, reading that book was fascinating because it has this kind of gonzo attitude. And there are parts of it that I could probably leave back in the 70s. But the absurdity and honoring the absurdity of it is actually really instructive, I think, for something like that for even some of our students who come in and they're like, oh, I'm going to write a play. It's going to be like people sitting in a kitchen talking. Like, no. Theater is actually way more adventurous than that. You can represent an extreme because it actually means a very grounded truth. Doing something outlandish doesn't mean that you're doing something cartoonish. It's a really powerful book.
I don't want to sit on my high horse and look at the person who's going to be a doctor, but you have no idea what it means to other people A lot of people get so much out of it because there was no, we're doing this conversation now about an avenue to explore other parts of being a human in medicine. But for so long, that didn't exist. This was the only thing.
There was obscurity to
a lot of
what
people,
that sign was.
Right, and a lot of people have read it dozens of times to get the most out of it. In fact, the TV show Scrubs the cast of that was told to read the book, and they use words that were coined in that book as well. That I'm sure you've heard of. Gomer was invented by Stephen Bergman, Samuel Shem, formerly known as Stephen Bergman. But so it's so wonderful how you can just kind of put your soul on the page or on the stage for a little while and get a little something out of it. Yeah.
I think it's interesting because I guess for people who are, I don't know, for me, like self-selecting into like medicine, the narrative that we're listening to or we're hearing it's fragmented. It's in segments. You only hear certain things, and then you get to hear the other aspect. For instance, like residents hear the bad things once the time is right. Right now, let's just focus on what you need to focus and keep going in that way. And yeah, like you're so consumed in trying to get the steps that you need to go through that you don't necessarily think about, what's to come, what's going to actually look like once I'm done, once I'm there. And yeah, it's almost like you're trying not to look too far ahead into the future because let's just we're here right now. Yeah,
I remember when I was turning 26 and all of a sudden I was going to need to get health insurance. Like, that's next year. that's I don't care. I'll figure it out then, man. Cross
that bridge once we get there.
Yeah, no, I don't want to deal with this. Obamacare's got me. I don't want to deal with this. No, but that's a really interesting, I think, problem is what we're dealing with now is like, wow, I was a resident and that was hard, and now I'm a doctor and it's harder, and I don't know what to do with all my emotions, and I'm scared to talk up to my colleagues because it's very similar to what the military is. And like, you'll notice the director thanked his predecessors, and that's what you do if you want to have a career in public, right? But
it's interesting you bring up the military. So one of the other programs that I drew inspiration from as I was getting ready to run this one was a program called Theater of War. It's run by a guy named Brian Dories, who was recently named like the theater artist of the city in New York or something. He does a lot of staged readings of Greek theater, and then he'll do it in a town hall format. So he's done it for like the VA. He's done it on military bases. He's done it at medical schools. And he'll pick a play, like do an hour-long reading of it, and then have this hierarchical, like a lack of hierarchy in the discussion afterwards. When I was talking to him, he's an alum of the college I went to, so I gave him a call and was like, I'm going to do this thing. I've never done it before. What do you think? Yeah. And that was, hierarchy was the biggest thing that he talked about, because in the practice of medicine, in the work of the military, right, there needs to be a hierarchy for certain tasks to get done. But to actually unpack how people feel about their work and diagnose and self-reflect how that work is getting done, you need to flatten that, at least temporarily. And so one of the things that theater can offer is the audience is a flat hierarchy. They are all experiencing it the same, and all of their responses are valid. And then in some of the best theater making that I've experienced, it is as flat as possible within the different roles that people have. We had, in our first year, we had a dean of ethics in the class, and we had first years, and we had a psych resident, and he has one of the professor's books on his shelf, but in our class they're on a first name basis, acting out different characters who are of different power levels, different power relationships.
So it's like dynamics. The exact opposite of the Stanford prison experiment. Instead of creating the wall, you were like we're all named Bob, and this is one safe space, flat line.
Yeah, not quite all named Bob. I see what you're saying though. Like, we are all of equal value.
Okay. I understand what you're saying. But then you keep the individuality, which is where you get the expression. Gotcha. Okay, that makes sense. That's really fascinating. So, have you learned how to be a better patient?
A little bit, only in the sense that I think I'm a little, I don't know that I was a bad patient before.
No, of course.
No, but I think being in the room with my GP, I'm more just thinking about, like, what else is he thinking about? How much of his brain can he carve out for me on a routine visit? and I'm going to come in here because I've had a bunch of bronchitis before, so now I have a cough and I just want to make sure that it's not that. And he's like, it's not, it's fine. And so then I'm leaving that room going, what did I distract him from? How much of his time did I waste? So maybe it's mostly me just being like, oh God, these people have a lot on their plate and I don't want to mess it up. But I am also certainly thinking about if I did need to and have needed to tell a story behind whatever I'm dealing with or what happened or something like that. Thinking about my communication with a doc is something that I think I was not doing before.
Yeah,
in the same way.
It's I always call medicine a parallel universe where it's something that's always sort of been there, but until you see it, until the curtain is pulled back, you're like, whoa, I didn't even think about it in that way. One of the things we talk about a lot is EHRs. I use, and I'm sure that somebody much smarter has coined a much more clever term, but I call this the Nobel complex. Alfred Nobel invented dynamite, which is as good as it is bad, right? Where EHRs are simultaneously this gift to healthcare, but they are also turned doctors into data entry analysts, which makes patients feel as if you're ignoring me. I gotta enter you into this computer.
I'm gonna document just for the sake of, first of all, conveying information to everybody else who's gonna be reading it, but also, who knows? If something happens and you gotta have that documentation that I was not I didn't miss anything. Right. So there's some of that fear there.
Well, here you get to have FaceTime with humans, right?
Yeah, no,
that's the goal.
Yeah,
and I think one thing that at least for the we're being taught right now is just you're gonna try to have the computer there, but try to before going to the room, sort of transition out of your day-to-day thing, and someone has actually during one of their lectures talked about that, how before going to the patient's room, it's almost taking that breath in of our transition into, okay, I'm going to play this role now, even regardless of what you're going through before. Oh my God, this all went to shit. And then this patient, this management I was doing for someone else, I don't know what to do with it now, but now I still have to see someone else. So I'm okay, let me collect myself. And at least for this point, let me play this role. And one important thing is at least I've observed and that we've been taught is now is trying to get rid of that hierarchy of the doctor knows it all. And it's almost just thinking about a physician more almost we know very much about this subject, but we don't know how it applies to you, so we're just going to not necessarily counsel, but what's that what people do, consulting. I'm almost like consultants. So at some point trying to remind, because we did pretty bad. I think the institution itself wrote on the idea of hierarchy, we are the doctors, and all that is crumbling down now because it's understood you're still human. You're not going to know everything. You can't know everything, and sort of how to encourage patients to say, no, you also have a stake in this, and I am good at knowing this, but I don't know how it applies to you. So I need you to also put your foot down and say, oh, listen, you're not paying attention to me. There's a point where my mom went to the doctor, and she's just she talked to me after, but she's the nurse came in, she talked to me, she gave me that medication, she said that this is what I was going to get, and then the doctor came in and literally for just 1 minute showed up and left, and she got so mad. She's no, hold up, you come back here, tell me what's going on, what do I need to take this for? And then the guy was shook, but then that was enough to say, oh, that's right, yeah, here. And he sat down and he actually gave it the time, and she was still pretty mad afterwards, but the fact is that he did sort of snapped out of it. So it's one of those things, you said, what else are they thinking? And there's a lot of thoughts going into your head, and sort of what it could be this, it could be that, it could be that, and you realize that someone comes I have a coffee, you're oh shit, okay, all right, what could it be? What's the worst possible thing that can happen? And just understanding and sort of getting rid of that hierarchy and saying now we're in this room. And I'm as much whatever I'm saying, whatever my opinion is, matters, but it's much more what you're thinking, what the feedback you're giving me is much more important than whatever I'm going to tell you. Just that's sort of where ideally it should head towards. And
then that's that's getting on stage 20 times in 10 days and kind of dying in front of a bunch of people.
Yeah. Well, and that's also thinking about it. The treatment or whatever lives with the patient. It doesn't live in the doctor's office, right? And in the same way, the play, even though the event occurred in the room with the actors on the set. Like, the actual effect of the play is in the seats, or is in the ride home, or is in, you know, their memory. We've done events where, you know, fundraising events or season kickoff events where people talk about plays that they saw here 10 years ago like they were yesterday.
Yeah, no,
they couldn't remember the 8 other plays that they've seen here.
No, 100%. That's. I mean, I was just thinking that same thing. Like, I've seen a dozen or so at Arden in the last 2 years. I remember A Midsummer Night's Dream, almost every minute of it.
Yeah,
it's weird. Like, I can't. It's almost like a song stuck in your head. Like, I remember what the actor looked like, very vividly. It's very. That's very poignant. So I think we're gonna wrap it up right there. I think I need both of you logistically to say I am first name, last name, and what your title is. Like, what your official, like, if I Googled you, what your title is.
I am Luis Aguilar. Actually, I have like my full name.
Yeah, the whole thing.
Yeah. So my actual full name is Luis Alberto Aguilar Montalban. That's 4 right there. And I am a second-year medical student at Sidney Kimmel Medical College.
I am Craig Getting. I am the education director at Lantern Theater Company and one of the co-teachers of the Empathy Project.
And so for Craig, I also want to get you saying when. So this is going to be like October, November. What shows will Lantern be putting on? What will you be doing in November, December 2018?
November, December 2018, you can come to the Lantern and see The Heir Apparent by David Ives, which is a French comedy that I'll be directing. It is a 21st century twist on an 18th century farce.
A big thank you to Craig and Luis for joining me on the MD Edge Post Call podcast. You can listen to part 1 of this conversation wherever podcasts are found. It's episode 6 in iTunes, Google Podcasts, Spotify, and Amazon. For MD Edge, I'm Nick Andrews, and this is the Post Call podcast.